Oh, good grief.
Travel nursing can bring you to places you've never been before. Tell us your story.
Good morning. It's Rita at the Travel Nurse Channel. If you're tuning in, we're live right now. If you have comments, please go ahead and comment on Facebook. Otherwise, we're archived. You can check us out anytime on Facebook or YouTube. And I say us, it's the Travel Nurse Channel company. But we do have guests from time to time, so I hope to start bringing you more guests in the coming year, which is right around the corner. So a couple more days till the end of the year. Let's see, Friday. Friday will be New Year's Eve, and then it will be 2022. So today, my personal experience with COVID is that it's been devastating to the world, to the United States, to this state of California, to many other states in the United States. And we're fortunate now that many of us are vaccinated. That was an option because this is America. And so now I'm going to tell you my personal experience is that my family I have family on the East Coast and the West Coast, a few in the middle, Florida and Texas, that my family that are vaccinated and my family that are non-vaccinated have gotten COVID over the last week or so. And is it Omicron? Is it COVID-19? I'm not sure. How are they feeling? They feel like they have terrible colds. The ones that were non-vaccinated were younger, so they have that on their side. And I'm not a resource. I am one of you, okay? So I am a nurse. I've worked with nurses for many, many years. I've worked clinically for many, many years, and I associate primarily with people in this field. So I'm not currently clinical. I'm actually a little disabled at the moment. I just had a new hip. And but I want to touch on things that are affecting you. So if you are a traveler, number one, how do you get to where you're going? Are you traveling on a plane? Are you traveling by car? My glasses always look crooked to me. I think it is my eyebrows are uneven. So that's information that you need. And then because we take care of patients and our clients look to us as a resource, that we naturally become a resource as far as one of the duties of a nurse and a physician and a healthcare team. And certainly you can refer them to the doctor, you can refer them to the Center for Disease Control, CDC, or World Health Organization, WHO. But it's good to have some information yourself, for yourself and for your patients. And certainly when you're a traveler, you want to know what the policy is where you're working, because it may vary from state to state and facility to facility. And for example, my mom is in an assisted living that includes both a memory care and a skilled nursing facility. So 3 divisions of healthcare in one building, one 3-story building. The larger portion are assisted living. The smallest portion is the memory care unit. And the medium size client population is the skilled nursing. And they've kept them very safe. They've had very few patients contract the COVID or the Omicron, the newest variant. And their policy right now for anybody coming in, so if somebody needs physical therapy, if somebody has to be seen by a specialist, somebody that is not a resident staff member, is not a resident client or a full-time staff member, somebody coming from outside to the facility. Everybody's wearing N95s. Now, when COVID first happened, that didn't happen. They took temperatures, they provided masks, they insisted that you wear a healthcare mask. So the disposable paper double ply, and they provided them if you didn't have them, and they took your temperature and they monitored your time of stay and so forth. But now it's N95s only. So they're back to that. So what are the details that you need? Well, you need to know mask requirement. You need to know testing requirement. You need to know if you're traveling that you're probably going to have to have proof of vaccination and proof within, depending on the airline and so forth, of a negative COVID exam prior to traveling, usually within 24 hours. So check with your recruiters, check with your employers, check with your airlines so that you don't plan your travel, particularly if it's by airline, and arrive without that 24-hour negative COVID exam. You may be prohibited from traveling, and it may throw a wrench in your travel assignment. So lots and lots of facts out there. Let's see what the CDC, I think I'm interested if you get sick, right? Prevention is wonderful, but if you get sick, let's talk about some of the current treatments and what they mean. Now, I have heard about this, and you may have too. There's an antiviral medication, and it is available in some states and some facilities, and some, at your physician, your provider, and so forth. And it is an antiviral drug. I think its trade name is Vekdury, V-E-K, no D, yeah, V-E-K-D-U-R-Y, Vekdury. But it's, most people are going to refer to it by its generic name, which is Remdesivir. Now, some states are out of it, some areas are out of it. Are they prescribing it for adults and pediatrics? Yes, they are pediatric COVID patients, 12 and older, and adults are getting this treatment. They have to weigh at least 40 kilograms or something. Anyway, so that's been going on for a while. If you can get it, why not? The original treatment, I believe they thought was a 10-day, 5-day course, 10-day course. Let's see what I have written down here. Conclusions of Remdesivir can help improve the clinical outcome of hospitalized patients with COVID-19, and a 5-day regime instead of a 10-day regime may be sufficient treatment. It appears to be tolerable as other comparators and placebos. So people are tolerating it. You only need it for 5 days. So check with your physicians, your providers, and I don't think they are prescribing it for cases where people are at home. At home, I think it's sort of the comfort care, the over-the-counter things. But again, check with your provider. So I'm not sure the reason. It could be the anti-inflammatory. Some of the NSAIDs are not recommended for symptoms of COVID, which are cold and flu-like symptoms, congestion, coughing, malaise, and low-grade fevers, sweats, and things like that. And so people usually have something, their go-to med that makes them feel better. I love Mucinex, but I would check if I were going through COVID personally and my family members that are in the throes of it at the moment. I'm recommending Tylenol. It's one of my favorite medications anyway. And I always think, oh, it's not doing anything. But then if you miss 6 hours of it, your pain comes back. You're going to, it must help a little bit. Yeah. So acetaminophen, 500 to 1,000, not to exceed maybe 3 to 4,000 in a day is a lot, but try to keep it at 3,000 if you can. So Tylenol is recommended where some of the NSAIDs are not. And that would include Motrin, ibuprofen, and some of the other over-the-counter. I'm not sure about aspirin, probably aspirin as well. But this is why you have a provider, and a provider should know you and your history and your makeup and so forth. So for your safety, we know about some of these meds. We know about this antiviral med. Are they providing it to patients at home? Probably not. They're providing it in the hospitals as of what I know in December. And in some states, they are in low supply of that. So FYI, by the way, let me see, make sure my comment line is open. We're live here on Tuesday, most Tuesdays. I didn't expect to see you today. I was actually looking forward to, okay, so the comment line is open. If you want to join in the conversation, please do. If you have questions, comments, whatever. It's Rita. I'm here most Tuesdays between 10 and 11 Pacific Standard Time. So I said last time when it was, I think it was a couple of days before Christmas. Yeah, last Tuesday was just a couple of days before Christmas and Christmas Eve. And I said, see you next year. But that's not true. Here I am. And it's still 2021 because I've been thinking about all this concern and safety and travelers traveling and travelers dealing with another surge of COVID. And here's the other thing. Is it Omicron or is it COVID-19? You may not know. It may take a while before you get that information on your patients. So they're both critical. Omicron is the most current variant of the coronavirus. And let's just go over some of the symptoms, okay? So you can self-check. Yeah, the big one. I mean, if you have a runny nose, is it an allergy? Is it a virus? Do you have other symptoms? So people are like, oh, I have a stomach ache. I'm going to go get corona tested. I think you don't need to be that proactive or that dramatic about it. So it's good to just kind of go over the assessment tools that we know. So much of it is still developing. We're still developing information about this virus. Okay, so let me give you some symptoms to watch for. These we've known about for the last, we're almost at the 2-year mark, right? We'll be at the beginning of year 3 in March, I believe. Okay, so top of the list is fever and chills, cough, shortness of breath, difficulty breathing. Those are things. Fatigue, muscle ache, body ache, headache. The presentation. Now, my aunt for many, many years lost her sense of taste and smell. I mean, part of that might have been the aging. Part of that might have been she was on a lot of different meds for her kidney and her neurosystem and her heart and so forth. So she took a lot of medicines. But if it was a new loss of the sensation of taste or smell, that's a pretty key one. That's pretty different than, oh, I have a cold and I have mucus and things don't taste as good. I really wanted spaghetti and meatballs and it just doesn't even taste that good. That's a little different than actually losing your sense of taste. And some people that I have talked to and have read about, in addition to that loss of taste and smell, things taste terrible. They taste like dirt. And I had that once with a medication, antibiotic. I'm not going to remember the name of it right now, but I would take that medication, and then whenever I ate while I was on that medication, things tasted metallic. So how awful to to have a nice piece of fish or your favorite meal or whatever, and it tastes like terrible and dirt. So those are the top. Down at the bottom, nausea, vomiting, diarrhea, but those are not the top. You have a little upset stomach. Don't assume you have COVID right away. So there are many, many symptoms, but at the top is the fever and chills, the loss of sense and taste, the congestion, the shortness of breath, difficulty breathing, the fatigue. It is a strong virus, so it is going to really affect you. And if you just have a little nausea and you're young, you might be pregnant. No, I mean, it could be many other things. So, you just don't want to walk around afraid and overreacting. When do you seek medical attention? Now, if you have one or more of those symptoms and you're really feeling terrible, that's the time. But absolutely, absolutely, medical attention is needed if you have trouble breathing. Come on, nurses. Come on, healthcare people. You know this. You know this. If you have pain or pressure in your chest, absolutely. If you have the onset of confusion, yeah, get some help. If you cannot stay awake, if it's you or if you're a family member and you can't get them roused and awake, you need medical attention. And of course, if you don't have good coloring, of course I have a little makeup on, but if my coloring were a little ashen or gray like my hair, or if I had blue around my lips, or your nail beds, that's another one, when you don't get that pink refill in your nails, but basically see kind of a bluish, purplish color to your nail beds. These are emergency signs to seek medical help and get to the hospital right away. Okay. And what is the isolation? What's the latest? Now, what site am I on? This is CDC. So this is your basic. This is my go-to site. When to quarantine is important to know, and how long to quarantine. Certainly when you're symptomatic. You quarantine when you think you may have been exposed, and you quarantine when you have any of the virus symptoms. You isolate when you have proof that you've been infected, and even if you don't have symptoms. So for example, some family members of mine heard that they'd been exposed, so they went and got tested. They did the home test, and then they scheduled to get the other test. Oh, we should talk about that too, the PC. Yeah, hang on a second, folks. I don't want to say it wrong. It's the P, the one that begins with P, that testing. They went and got that testing that takes a few days to find out if they were positive. And one of my family members was positive and his wife was not. What is that called, that test? Darn it. Darn it. I'm sorry I'm hiccuping here. I didn't really prepare. I'm so sorry. I usually have, a week's worth of research at my fingertips. And today I have like, half an hour. Well, the current test that takes a bit, takes a day or two to come back to you. Let's just see, current testing. It begins with a P, and it's not coming up. Testing. Testing. The regular test that we get is called the SARS-CoV-2. It can detect COVID-19. Can detect the virus that causes the COVID-19. But the one you hear people talking about is, it's not coming up on the CDC site. Darn it. That's the basic test, your SARS-CoV-2. There's self-testing and self-checkers. And there's information on the CDC on how to do that. They give you little YouTube videos, so that's really great. But I can't find this one everybody's talking about. Oh, the P. Let's see. I'll put it in here while we're still online. Anybody checking in? No. Okay. I am hiccuping through this episode. What test is specific for COVID-19? Here we go. Different types of testing. Diagnostic tests will tell if you have the coronavirus, and you should take your isolation and quarantine cue from that. The molecular diagnostic test is the PCR. There we go. The RT-PCR. It detects the virus's genetic material, and antigen tests that detect specific proteins on the surface of the virus. They typically are collected with either throat or the nose. The last time I was tested, it was the throat. She gagged me. She did a couple of swabs on one side. I was okay. And then when she got to the other side, it gagged me. So yeah, people, PCR, but it's actually RT-PCR. That is the molecular test, and it does take, it takes hours. I don't think it takes a day, but you don't get the results for the day. And it just depends on how many clients they're seeing that day and what their staff situation is. But generally, for me, for example, going into surgery, they wanted it 2 days before. They wanted to be sure to have the results before I showed up in their OR, potentially spreading the coronavirus. I did not have it. I have not had it. I've been very fortunate. I've had the vaccine 3 times. So I had the first, the second, and then the third booster. And I imagine you guys by spring, they're talking about having an additional booster. And why not? Because this sucker is here, and it's variants are coming, and nobody likes to be sick. And I think when we were in quarantine and being so careful about, lots of hand washing. Do I still? Yeah. I always keep my antibacterial thing here because I'm always touching my hair, my clothes, my face, or my nose, or whatever. And so I want you to see that I am scrupulously, constantly spending seconds, at least, 15, 20 seconds, constantly washing antibacterial, because I live with other members in my family. And you may live with a pet, and there's information out there on the effects on pets. So PCR diagnostic test, that's what we're talking about, PCR. That is not the home test. You do need to go to a clinic or a testing site, a hospital, wherever it is for you, if you want to be absolutely sure whether or not you have COVID. Yeah, so not great news, not great news. But we need to stay current. And how are my nurses doing? How are my healthcare people doing? We have always had lots of hazmat and precautions and disease precautions and so forth. That's always been part of the training. And we've always had, we have had contact many times with things we didn't know what we were dealing with. So we did the scrupulous hand washing. We did the masking. We did the gowning, to protect ourselves and to protect the patient. So, so that is pretty standard routine. But when you're busy, it's easy to forget, and you're no good to anyone if you get sick. So please, please, please protect yourself at all times, especially at work. But I was talking about traveling. Where did I put that information? By bus and so that by bus and train, and I keep losing my pages. Yeah, who are the people at risk? I think it warrants talking about it. People with medical conditions, maybe they're immune compromised for whatever reason, they're getting chemotherapy, or they have a disease that puts them in an immune compromised situation. Diabetes is actually up there. Heart disease, immune suppressant. I can't think of all the diseases, but there are many. So those medical conditions, those families, that live, when you live with a group of 3, 4, 5 and up, you live with your family. And if one person is maybe working in a very populous area, like a prison. Oh, that's another one. Prisons are, if someone there gets it, that's a lot of people living in a space. And so those are going to be people at risk, people living and working in jails, people living in maybe maybe smaller housing with larger families in it would be another area. People with specific conditions, medical conditions, immune suppressed diseases, medical conditions. Pregnant people are more at risk. Usually their babies are safer than they are. Who else? My poor travelers are dealing with the unknown many times. And so they have to be really, really doing a lot of self-care and prevention. And then traveling in general will put you, and I believe I traveled in July, took a vacation to see a national park in Montana and stay on a lake. It was absolutely lovely. So domestic travel and international travel. You want to have your cruise ships. Some people that were prevented from taking their cruises at the beginning of COVID, had a year or more to replan that cruise. So find out if you're going to have to be wearing a mask and so forth, and what they're doing as far as stopping imports or people providing negative COVID testing prior to taking the cruise. It's still rough times, folks. It's not all doom and gloom, but I think it's prudent to have a discussion, to talk about safety measures, to remind everyone to do self-care and preventative health care. Your N95s are not comfortable. I understand. I have used them. I have them. But I thought we better talk about it. So I'm not seeing people checking in. So here's what I want to talk about prior to checking out, that I will continue on Tuesdays between 10 and 11 Pacific Standard Time, that I will continue to broadcast via Facebook and YouTube and archive them so that you have access there's usually a title, like today we have a title of a COVID, Omicron, treatment, testing, etc. So usually there's a title to guide you to what the discussion is going to be about. And today, mostly what I want to tell you, because I am not a major resource, I'm just a nurse that cares about other nurses, and I particularly focus on nurses and healthcare workers that are travelers. And but I want to give you what I have gleaned from the communications I receive via websites like the CDC, the WHO, the World Health Organization, and clinical trials and nursing sites that I visit all the time, and what I'm getting from my community and my physicians and my providers. One of the things that I would recommend is if you think you've had an exposure or you are having any of those symptoms of fever, chills, loss of taste and smell, difficulty breathing, extreme congestion, all those things, fever, chills, to seek medical attention, to connect with your healthcare provider and get the most current information. To my knowledge, that antiviral med is only being provided in hospitals, but I could be wrong. Maybe in your town or your facility, they're providing it in clinics and urgent cares. I'm not sure. So check with your provider. Always to have that discussion with your provider, because they know you best. Hopefully they know you best. Where you go in, if it's a new provider, you give them as much information about yourself that you can. You know, do you wear glasses? Do you need a hearing aid? Do you have any skin conditions? You know, what's your health? Is it fair, poor, good, very good, or excellent? And then if it's any one of those, you need the details to back it up, you know. So I would say my little baby granddaughter, who's going to be 2 in March, has excellent health for the most part. But has she had the sniffles? Yes. Has she had any diseases? No. So she has sensitive skin. That might bring her down from excellent to very good. I don't know. But anyway, so if she were meeting a new provider, it would be a short report. She's only been around for less than 2 years. So there. But now if you've been around for 30, 40, 50, 60 something plus years, it is possible that you have had a few accidents or diseases or viruses or chickenpox or something, you know, something in your history, something in your makeup that a healthcare provider should know about. Okay, so I'm thinking about you, and we're having a little resurgence of COVID. We're seeing the Omicron, and we're seeing some treatments that we didn't see a year and a half ago. So there's all that. I hope you don't have this terrible infection. I hope you, I don't know what to say, kicking and screaming, jumping for joy, at least grinning. I hope you go grinning into the new year with hope and gratitude and prevention in mind. Okay, those are my wishes for you. Not necessarily jumping for joy, but if you're jumping for joy, I'm happy for you. Okay, I'm going to sign off. Know that we'll be here next Tuesday. I am looking for wonderful guests for you, and authors, wonderful guests we've had over the past year. So we'll try and get you some more. I will sign off with my little commercial about the Travel Nurse channel. You can find out more about us. We're always working on our website. We have thousands of nurses, thousands of viewers, hundreds of customers and clients and sponsors. So check us out, the Travel Nurse channel, www.travelnursechannel.com. You can call me anytime, whether we're live or not, 800-737-6518. You can email me, Rita, R-I-T-A, at travelnursechannel.com. And until next Tuesday, and until next year, I hope you go into the new year grinning and full of gratitude and hope.
Travel nursing can bring you to places you've never been before. Tell us your story.